Is cranberry juice good for a UTI?
Okay, so cranberry juice, a lovable drink. Is it good to prevent urinary tract infections or treat them or
Right.
reduce the chance of getting one?
So this is something that's been talked about for decades, and there is evidence on both sides of this argument.
All right.
There's a lot of potential bias in the studies that have
Mhm,
done this. As you can
mhm.
imagine, the cranberry people really want it to work.
Ocean
And
spray.
yeah, ocean spray. Yeah, you name them. And then the other people are like, well, let's just try to take a look.
Yeah.
So urinary tract infection is when a bacteria that's outside of your body ends up inside your urinary tract. And that includes everything from your urethra, the little tube that goes from your bladder to the outside environment, your bladder, your ureters that connect your bladder to your kidneys, and your kidneys themselves. So the
Ureter.
infection, ureter,
Ureter.
it includes any of those areas. And the most common type of bacteria is E. coli. This is common in fecal material. And this is why we get urinary tract infections. These
Geography, baby.
it is, and can be very, very debilitating and potentially very dangerous, even life-threatening. So much more common in women because the
Yeah.
length of their urethra is much shorter. It's actually 3 centimeters.
Yes. You
Um,
know what? It's true. When I was a resident, I remember I was a junior resident
yep,
and I was putting in a Foley catheter
right.
in a patient. That's where you insert a tube into the urethra to help them drain the bladder.
Right.
And he said to me, you have to do this under sterile technique because you can kill someone by putting in a Foley catheter.
Like
If they
that's a
get
bit of an
infected.
extreme statement, but I guess it
Extreme.
is
But then
true.
ironically, after I did that, then I went to the washroom and the guy coded for unrelated reasons.
Oh,
But I was
wow.
like, wow, he wasn't kidding.
Wow.
But anyways, he was okay after that. But it was
Okay, so
coincidental.
so urinary tract infections are very, very common, up to 8 million a year in the US, so probably just short of 1 million in Canada. Very, very debilitating and expensive for the healthcare system. So,
Yeah. And no fun for you if you get one.
right. So the question is, can cranberry juice or some component in cranberry reduce the incidence of a urinary tract infection or treat one that you had? So let's get that right out the gate at the beginning. This does not treat an active urinary tract infection. This
Yeah.
is not a treatment. If you have a urinary tract infection, you should see your primary care provider.
Please do.
As well, if you have recurrent urinary tract infections, you should also see them because this may be a sign that you have an anatomical abnormality that is predisposing you to this. So
Please do.
treatment does not help at all. So
Right.
can it prevent? So we're talking about an article that I read in European Urology Focus.
Okay. The EUF, you mean?
Yeah, I don't think anyone calls it that, but
EUF?
yes,
I do.
published this past summer
Mhm.
where they did a meta-analysis. They looked at 4,000 studies.
Wow.
They whittled them down to 20 studies that met the inclusion criteria, and that included 18 randomized controlled trials and 2 non-randomized controlled trials. And
RESPCT for the RCT.
yeah, pretty
That's the
impressive.
way to prove something.
Pretty impressive.
Randomized control
It
trial.
also goes to show that so many of those papers on this topic were not necessarily useful or had parts of the study that were not good enough to say, hey, we believe what they found.
Womp womp.
So the total number of patients in these 20 pooled studies was 3,091. So that's the benefit of these types of studies that we talked about before. It increases the sheer number of patients. And what they did is they looked at cranberry juice, cranberry supplements, and they compared it not only to nothing, but also to water or placebo liquid treatment. Because a lot of people say, well, you know, hold on. Maybe it's not the cranberry juice that's helping. Maybe it's that hydration and the flushing
Which does
out
help
action.
too, right? Being hyperhydrated does help because you're peeing a lot, and that is keeping the one-way direction going so that the bacteria don't come in. So
100%.
a lot, hydration definitely does help as well.
It's key. So why cranberries? So what they think is that cranberries have a component called proanthocyanidins, which is a type of polyphenol that alters something that reduces the adherence of bacteria to the wall of the bladder or the urinary tract. And they're not sure if it affects the wall or it affects the bacteria. They don't exactly know the science behind it, but this is the thought or the hypothesis of why it makes a difference at all.
And bacterial adherence is a big thing because for bacteria to thrive, it has to adhere itself. That's why in our world, on implants, on in bone and things like that, bacteria can adhere, and that's where we have our problems. And UTIs, if you're wondering why a couple of orthopedic surgeons are talking about UTIs, it is important to us because very often we have someone booked for an elective surgical procedure. Lo and behold, they are diagnosed with a urinary tract infection day of, day before, and then we have to consider delaying your surgery because we don't want you to get an infection in your knee or your hip or whatever, implanting by way of the bacteria that you have in your bladder or urinary tract or something like that. So we do come across UTIs quite frequently, and they do interfere with our treatment plan as well.
Quick side note, if you've had a urinary tract infection, if you struggle with urinary tract infections, or you've used cranberry juice to deal with them, please leave a comment. Okay, so what did they find? So what they found was that in 54% of the people that were taking the cranberry juice, they had a 54% reduction in the incidence of urinary tract infections. So they reduced it by almost half, compared to 27% reduction in the placebo liquid group. So to your point, staying hydrated reduced it by a quarter. Adding the liquid or changing the liquid to be cranberry involving was 54%. The other thing they looked at was antibiotic usage over prolonged periods of time. And what they found was that cranberry supplements definitely reduce your incidence or your use of antibiotics by 59%, whereas the liquid version was 49%. So the difference between the two is not quite as great as the incidence of the infection itself, but definitely reduced antibiotic use. And this is a huge concern in our world.
You may be
right?
thinking, oh, who cares? We'll just use antibiotics to treat it. The problem with using antibiotics ubiquitously is that bacteria become resistant. When bacteria become resistant, then we need a newer antibiotic, a stronger antibiotic to deal with it. So it is a big deal. That's why we are very judicial in the use of antibiotics, because we do not want to breed bacterial resistance in the community.
Right. So for me, the take home from this article is that yes, cranberry juice may have something in it. Make sure that it's pure, that there's no added sugar in the juice, and that you're taking a large amount of volume with it. This will not treat an active infection, but can help prevent it.
Did they check if in the form of a Cosmo, the cranberry juice in a Cosmo martini, isn't that cranberry juice? And
well, I guess theoretically it would depend on the type of cranberry juice, but yeah, I would argue that the negative effects of alcohol probably would negate it, but maybe not for UTIs in general. But I don't
check it.
Yeah,
Wasn't in the article?
it was not in the article.
Good to know.
But what I would say is that if you're trying to reduce your incidence of infections, they recommended 3 things primarily. So good hygiene.
Right.
That's the first one. Wiping front to back, which seems intuitive.
I always do.
Yep. Considering voiding after sexual intercourse and staying well hydrated. Those were the tips that they said, general approaches that can help reduce the incidence of UTI. And yes, if you are someone who is predisposed or concerned about it, you could consider some cranberry juice or cranberry syrup.
Common sense. Maybe we should tell all our patients before they come in for a joint replacement to drink cranberry juice the week before.
Yeah, I'd say the evidence is not quite robust. I think when they commented on how confident they were, it was like moderate to low confidence, you know, when they say rather than like high confidence. But you know what? I think it's something. There's a lot of controversy, but that's just one recent article that shed a little bit of light on this topic. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.